Hello and welcome to Insight Ophthalmology. This is Dr. Amrit welcoming you to another lecture. Today's quest is on the lacrimal syringing and probing. At this onset, I would like to add that if our videos add any value, kindly subscribe to our channel. So what is inside this video? Today we shall study about the punctal dilation, lacrimal probing, lacrimal syringing, hard stop versus the soft stop, and how to interpret the results of lacrimal syringing and probing together. So what is lacrimal syringing? Lacrimal syringing is basically a diagnostic procedure in which sterile saline is pushed into the nasolacrimal apparatus through the puncta, and thereby you are basically testing the patency of the tear drainage pathway. So what are the indications of lacrimal syringing? It is done to rule out any blockages in the lacrimal drainage system, and at the same time you can also identify the site of blockage. That means whether the blockage is present at the level of canaliculus, or is it at the common canaliculus level, or is it at nasolacrimal duct. Apart from that, another important indication for lacrimal syringing is as a pre-operative assessment tool before any intraocular surgery like the cataract or glaucoma surgeries. It's very important that you rule out these blockages because these can actually lead to secondary infections even in the eye. So what happens is that whenever there's a blockage, it can actually cause buildup of the tear secretion in the apparatus, leading to infection within the apparatus first or within the sac, which is called dacrocystitis, and later on, if a patient with dacrocystitis is actually operated, he will definitely have infection of the eye, which is called endophthalmitis. So very, very severe infection, and therefore it is always important to do syringing before such surgeries, and if the syringing comes out to be negative, such intraocular surgeries are actually contraindicated in such patients. In case of dacrocystography, again, we can use syringing to inject the dye for the purpose of imaging, and it can also be used as a route of drug administration. Now, in my previous video on the anatomy of lacrimal apparatus, I mentioned the various structures which are involved in the tear transport and tear formation. The structures of tear transport in particular are important for us to understand syringing. We have the puncta, the canaliculus, the common canaliculus, the lacrimal sac, nasolacrimal duct, and the opening of the nasolacrimal duct, which is guarded by the valve of Hasner. First of all, let us discuss about the lacrimal dilation. So what is lacrimal dilation? Here you are basically dilating your puncta. And why do you actually dilate your punctas? It is particularly used to dilate the smaller punctas before syringing. Apart from that, sometimes the punctas might be totally occluded or closed, and such puncta are called the punctal stenosis. Here, your punctal dilatation can actually act as a temporary relief. Apart from that, in canalicular repair with the Monoca stent also, we will use punctal dilation. Now, there are basically two types of dilators which are available. We have the nettleship punctal dilator and we have the Castroviejo lacrimal dilator. As you can see that the first one has this fine end, on only one side, whereas the Castroviejo variety actually has this fine tip on both the sides. Now the question is, how do you actually do this punctal dilation? So it's step one, basically you actually enter vertically into the puncta, and this is because of the direction in which the canaliculi are arranged. Now in the video on the anatomy of the lacrimal apparatus, I explained to you that the canaliculus actually has a vertical segment and then it has a horizontal segment. And therefore, if you want to enter the puncta, it's advisable that first you basically sterilize your dilator with a mediswab or iodine, and then you insert the dilator vertically downwards for about 2 mm, because that is the length of your vertical segment of the canaliculus, and you do it in a very gently rotating it clockwise and anti-clockwise direction. Once you enter the vertical segment, now it's time to enter the horizontal segment, and for this it is advisable that you give certain amount of lateral traction on the lower lid. So what happens is that as you give lateral traction or you pull the lower lid temporally, it will actually straighten up the ampulla, which is the junction between the vertical and the horizontal part of the canaliculus. At the same time, it will also straighten up your canaliculi. That means it will line up the vertical and the horizontal canaliculus. Now you're going to gently rotate the dilator horizontally and insert the dilator. So this is how you basically dilate your puncta. Now the next thing what you do is what is probing. Okay, so first of all you should know what is probing. Probing is just a process of passing a thin metal instrument, which is called a probe, as you can see over here, into the lacrimal sac. And in case of therapeutic probing, you actually pass it down from the sac into the nasolacrimal duct as well. And this is done first of all to diagnose any possible blockages along the lacrimal apparatus and also to open up those blockages. But for the purpose of this video, we shall only be limiting ourselves to the diagnosing capabilities of the lacrimal probing, and that too at the level of the common canaliculus and the sac. So, what instruments are you going to use for probing? We basically use these Bowman's lacrimal probes. They are available in various sizes, and the sizes are actually written like this, as you can see in the picture. So you can have these 4 zeros, 3 zeros, 2 zeros, or single zero like this, 1, 2, 3, 4, 5, 6, and so on. Okay, that's how the sizes are written on the Bowman's probe. So what does this mean? So the number on the probe actually corresponds to a particular size, and such a probe you can actually use in a particular amount of age of the patient. So suppose you have 4 zeros, it basically means 0.7 millimeter, and such a probe can be used in a child who is 3 months old. And similarly, you can actually go through this table which actually tells you the number of the probe and how does it correspond to the size of probe and the age of the patient. Now, the lacrimal probing also is done in a very similar fashion. That means first you insert the probe in the vertical direction so that you go ahead, so that you cross almost your vertical segment of the canaliculus, and then you flip it horizontally, rotate it horizontally, and enter the horizontal segment of your canaliculi. At the same time, as you are entering the horizontal segment of the canaliculi, it is advisable again to give lateral traction on the lid so that you line up the vertical and horizontal canaliculus. And then you are going to actually enter the common canaliculus, and finally you are going to enter your lacrimal sac. Now the question is, what is meant by hard stop versus soft stop? Now, as you basically do your probing, you will notice that as you pass this blunt probe medially through the punctum, it passes through the canaliculus and then it reaches the sac, okay, and you actually advance it till the probe comes to a stop, enabling you to feel a hard structure over here. And this structure over here, which is hard, is basically your lacrimal bone, and this is called the hard stop. So hard stop basically means that you're able to pass your probe nicely through the puncta. You're able to pass it through the canaliculus. You're able to pass it through the common canaliculus, and now you're hitting the bone. That means you have passed it up to the end of your lacrimal sac, and you have hit the lacrimal bone. And as you hit the lacrimal bone, you get a hard feeling, and this is called a hard stop. Okay, and a hard stop basically means that your common canaliculus is patent. Then sometimes, however, what happens is that there might be an obstruction in the canalicular system which does not allow your probe to pass through directly into the sac. So what happens, as you put your probe, your common canaliculus is also going to be dragged, it's also going to get dragged along with the probe, and the feel that you get over here in this case is not as hard in the first case, and this feel is actually called the soft stop. And a soft stop basically means that there is a canalicular obstruction and the probe is actually hitting that obstruction of the canaliculus rather than hitting the lacrimal bone, what it does in case of a hard stop. So I hope that is clear to you. So in a hard stop, basically what means that the common canaliculus pathway is patent, and what you are hitting over here is the lacrimal bone, whereas in soft stop, you are actually hitting the common canaliculus obstruction area and you're not actually directly hitting the lacrimal sac wall through the bone, and therefore the feel is more soft, and therefore this is called a soft stop, which basically means there is a common canalicular obstruction. Now this is very important point which I want you to remember till the end of the video, where we'll be discussing about the interpretation of the various situations of syringing. So basically, this probing is done to diagnose your upper lacrimal system blockage, and to be more particular, the canalicular blockage. Okay, so what happens is that if there's any obstruction, you are going to measure it right from your puncta. Okay, so the distance of that obstruction from the puncta, if it is less than about 3 millimeters, then that is called a proximal blockage. Okay, and if the distance of the obstruction from the puncta is about 3 to 8 millimeters, that is called a mid-level obstruction. Whereas if the distance is more than 8 millimeters, it is called a distal obstruction. So basically here the cutoff point is about 8 millimeters. Okay, it is usually considered that at 8 millimeters you have the common canaliculus. Okay, so if you find any obstruction at about 8 millimeter distance, it means that it is a common canalicular obstruction. And any obstruction, that means your probe is stopping at a distance less than 8 millimeters, it means that the obstruction is in the canaliculus and not at the common canaliculus or the proximal obstruction. So I hope that point is clear. Now, the same hard stop or soft stop you can also feel with your lacrimal cannula, which is attached to your syringe. Okay, so most of the time what we do is we actually carry out syringing using a lacrimal cannula, and with the same cannula we actually feel the hard stop and the soft stop. So if your lacrimal cannula is easily passing and you're able to feel the lacrimal bone through it, that is called a hard stop. However, if you get some soft resistance in the passage of the lacrimal canalicula and you get a soft feel, that is called a soft stop, indicating a common canaliculus block. Now let us go about how to do the syringing. So before you start, you are always supposed to wash your hands, position the patient comfortably with the head nicely supported, ensure that there's good lighting because you should see the punctum clearly. Always explain the patient what you're going to do, because many patients will be, a lot of patients will actually be afraid looking at your syringe. And what will you need for syringing? You need normal saline. Apart from that, you need about 1 ml syringe. A 1 ml syringe is usually indicated because it is seen that if you use bigger syringes like 5 ml or 10 ml, the pressure within the lacrimal apparatus or the lacrimal system actually increases, and that will actually lead to more harm than good to the patient. Apart from that, the dilator, you can use a nettleship or the other one. You can use a sterile lacrimal cannula, which you can be seen over here. Now, this cannula is available as a straight one or a curved one. Then you have to use some local anesthetic eye drops. Apart from that, we need some cotton wools or gauze, a towel, and some gloves. So what do? So you basically use a towel to avoid spillage, and then before you start dilating the puncta, okay, first punctal examination is very important. You can do it under torchlight examination and decide if the punctum is of appropriate size to proceed with syringing. If the punctum is small, you might want to dilate the punctum. However, here it's always advisable that you check your nettleship dilator tip. Most of the time the dilator tip might be damaged, and it is advisable that you don't use those dilators and use maybe another one. Then you have to use a syringe. With a syringe of about, say, this insulin syringes you can use, you can draw up to 1 ml of saline, and then you have to attach this lacrimal cannula to the syringe. And before you actually do syringing, it is also advisable that you flush the cannula with small amount of saline to ensure that it is patent. Next, it should be done under local anesthetic eye drops. You have to wait for about 30 seconds, and sometimes you can actually put these drops in the area of the lower punctum as well. And you ask the patient to look upwards and in the outward direction so that your cornea is out of your examination or testing field. Okay, and you ask the patient to maintain this gaze until the procedure is actually over. Now, with a cotton wool or a gauze, you have to pull the lid downwards and also give slight amount of lateral traction on the lower lid. This is basically done so that your vertical segment and the horizontal segment will actually line up together. And then you will inject the fluid. The fluid has to be injected very, very slowly and you have to now ask the patient if he's able to experience a salty taste at the back of his throat or in his nose. Okay, so what happens is that as you inject the saline very slowly through the punctum, it is going to pass through the lacrimal sac and then it's going to come out of your nasolacrimal duct behind the inferior turbinate into the nose, and finally it's going to go into the throat of the patient. So you ask the patient if they are actually able to feel that salty taste at the back of the throat. Now, if the patient says no, he's not able to feel any taste or any water in his nose or throat, it basically means that there's some sort of blockage in the nasolacrimal apparatus, which is preventing the free flow of the normal saline through this lacrimal apparatus. However, at the same time, you also have to check for regurgitation of fluid through this puncta. In our previous video on the nerve supply to the lacrimal gland, we asked a question that with which cranial nerve is the lesser petrosal nerve associated? And the answer to that question is the glossopharyngeal nerve. And I would like to congratulate Bharati S for giving out the correct answer. So now let us interpret our syringing results in detail. Okay, so we shall be interpreting the lacrimal syringing and probing results basically as a basic interpretation and advanced interpretation. So basic interpretation is that the patient says that yes, I could taste the saline at the back of my throat. It basically means that there is no obstruction at the lacrimal drainage apparatus. So the lacrimal drainage apparatus is patent. However, if the patient says no, none of the fluid actually came to my throat or nose, it means that there is some obstruction at the lacrimal drainage apparatus, and you have to now check from where the fluid is actually coming out. It might be actually regurgitating through one of the punctas. Now, advanced interpretation basically means that now we are going to combine not just the syringing, we are also going to make note of the type of regurgitate which is coming out from the punctas. At the same time, we are also going to do probing and combine all those three to come to the clinical diagnosis. So let us see situations. So in situation 1, say you carry out your syringing through the upper puncta and you notice that 100% of the fluid is coming out from the same puncta. Similarly, to the lower puncta also, 100% of the fluid is coming, right? So the first situation is in which your 100% regurgitation of the fluid comes through the same puncta through which you are carrying out your syringing. And here the fluid, say, is of clear nature. That means you have a clear regurgitate. Then you go ahead with the same syringe and you do your probing. And in the probing, you observe that there is a soft stop or a proximal obstruction, right? So it basically means that there is a canalicular block, right? So in canalicular block, as I told you, there will be a soft stop, and proximal obstruction means that the stop is of less than 8 millimeters length, or the stop is present at less than 8 millimeters length, and there is 100% regurgitation which is occurring from the same puncta. So here, if you're carrying out syringing from the lower puncta and there is 100% regurgitation of the same clear fluid through that lower puncta, it means that there is a canalicular block of the lower canaliculus. Similarly, if you carry out syringing through your upper puncta and you notice that 100% of the regurgitation of fluid is occurring through the upper puncta, it means that there's a canalicular block in the upper canaliculus. Now let us go ahead with the second situation. In the second situation, say 100% of the regurgitation of fluid occurs, but it occurs through the opposite puncta. Now in both of these situations, patient will answer that he's not able to taste any saline in his throat. Okay, so here 100% of regurgitation of fluid is occurring through the upper puncta. That means if you are carrying out syringing from the lower puncta, 100% of the fluid is coming out from the upper puncta, or if you are carrying out syringe from the upper puncta, 100% of the fluid is coming back from the lower puncta. Now there are two situations in which this can happen. Either the patient can have a blockage at the level of the common canaliculus, so that whatever fluid you are passing, it is actually it's coming back through the other puncta by hitting this common canaliculus, or there is some blockage at the level of the nasolacrimal duct, because of which whatever fluid you are sending through one canaliculus is actually hitting this blockage and then coming back through the other canaliculus, right? So either of these two situations can actually occur. So how do you differentiate between the two conditions? So we will make a note of the type of regurgitate. Now suppose we get a mucoid regurgitate, right? You carry out your syringing, and in syringing you find that there is a hard stop. So what did I tell you? Whenever there's a hard stop, it means that the common canaliculus is patent. So clearly here, very easily you can tell that the obstruction is at the level of the nasolacrimal duct, and here there's a complete nasolacrimal duct. We are calling it as a complete nasolacrimal duct because none of the fluid is actually going into the patient's throat or into the nose, and 100% of it is actually getting out, is coming out from the opposite punctum, right? So in the first case, it is a complete nasolacrimal duct blockage. Now, what if the regurgitate is of clear nature? Again, you carry out your probing. If you find a hard stop, again, it basically means that there is an obstruction at the level of the nasolacrimal duct. So again, there's a complete nasolacrimal duct, but here the sac is basically fibrosed. Okay, so the sac is basically fibrosed. So what happens is that whenever you have a fibrosed sac, that fibrosed sac cannot actually produce any sort of mucus, and therefore the type of regurgitate that you see in this condition is a clear regurgitate. So I hope now it is clear why it's very important for us to notice a type of regurgitate. Okay, so if you have a clear regurgitate and there is 100% regurgitation through the opposite puncta, and on probing you find a hard stop, it means that there's a complete nasolacrimal duct obstruction with a fibrosed sac. Now, what if in the similar case you were to see a soft stop? If there was a soft stop, it means that the obstruction is at the level of the canaliculus. That means here we have a common canalicular block. Now let us talk about a third situation. Now what if less than 100%, that is the partial regurgitation of fluid occurs through the opposite puncta, and the patient actually responds yes to taste sensation? What does it mean? It basically means that as you are carrying out the syringing, some of the fluid is entering into the nose and throat, and some of it is actually regurgitating back into the eye through the opposite puncta. Now again here there could be two situations which could be responsible for this. Either the patient actually has this stenosis of the common canalicular system, or the patient actually has a partial nasolacrimal duct obstruction. Again, how will you differentiate the two conditions? It is very similar to that of situation 2. You will notice the type of regurgitate, whether it is mucoid or clear. If it is a mucoid regurgitate, you carry on with your probing. If there's a hard stop, it basically means that here it is a partial nasolacrimal duct obstruction, right? So because of the hard stop, we know that it's a nasolacrimal duct obstruction, and because some amount of fluid is entering into the throat and some is coming out, it means that there's a partial obstruction. Now, what if you see a clear regurgitate? If you see a clear regurgitate, again you see a hard stop, it basically means there's a partial nasolacrimal duct obstruction with a fibrous sac. And if you see a clear regurgitate but a soft stop, it means that there's a common canalicular stenosis in this case, or you can call it as a partial common canalicular blockage. Now let us talk about situation 4. Now sometimes what will happen is that when you carry out syringing, you will notice that the fluid is freely passing, but there is no sensation felt in the throat. The patient does not respond in any affirmatives, and sometimes it might actually become very painful also for the patient. Now in such conditions, you have to suspect two things. One is the presence of an internal fistula, and second is the presence of a false passage that you actually created with your syringe, or the previous examiner created with the syringe, and not the real lacrimal apparatus pathway, right? So to summarize, lacrimal syringing, when we say it is positive, it means that we have an anatomically patent lacrimal system. Okay, and what you need to understand is that the lacrimal syringing is not a physiological test. It gives no information about the functional blockage. That means it does not tell us anything about the hyperlacrimation. It does not tell us anything about the lacrimal pump, which is actually responsible for bringing those tears into the puncta canaliculus and the lacrimal sac. Okay, here we are actually using a syringe to forcefully push the saline into across our lacrimal apparatus, right? So it's not a physiological test. It is just a test which will tell you about the anatomical patency of the lacrimal system. So whenever someone says lacrimal syringing is positive, it means that the lacrimal apparatus is patent anatomically. So now, what are some of the contraindications of syringing? Whenever there's any acute infection, it is better to not do any sort of syringing, because then you will actually be transmitting the infection to other parts of the eye. So in case of acute dacrocystitis, obviously it is going to be very painful for the patient, so do not carry out syringing. In lacrimal abscess, acute conjunctivitis, again you will actually you will spread the infection from the conjunctiva into the lacrimal sac, and also in cases of stones of the lacrimal sac, because then you might actually push those stones into the nasolacrimal duct with your syringing pressure. Now, there's another situation in which there might be a freely patent pathway. That means syringing will be positive. The probing also will be normal. You will not find any obstruction. However, the patient is still complaining of epiphora. Now, there it means that because syringing is positive, probing is normal, it means that you do not have any anatomical problem in the lacrimal apparatus. But here, the problem is more of a physiological problem or a functional problem. So that is something that we will discuss in our next video on the lacrimal pump mechanism. And in the same video, we shall also be discussing about the fluorescent dye disappearance test and another test, which is the Jones dye test 1 and 2. Now, before we end, this is a practice question for you. Where is the obstruction present if there is a regurgitation of clear fluid through the opposite puncta and you encounter a hard stop on probing? So if you know the answer, give the answer in the comment section. And if this video was of any value to you, kindly hit that subscribe button. So that's all for today. Thank you and have a nice day.